Assalamualaikum doctors. In this video I am discussing about splenectomy consent scenario. So that is any disease like it can be hereditary spherocytosis, the child needs splenectomy, we need to talk. First we look the pictures. The incision of splenectomy, it is very important, it comes on clinical. So incision, it can be that is median laparotomy scar. Look that laparotomy just above the umbilicus, and that is incisions, it is laparotomy, that laparoscopic surgery by the 3 dot. So one is laparotomy, median incisions, and another is laparoscopic surgery. Okay. So as usual we start that IRCAP. Hello Mrs. Alia, I am Dr. Emma, one of the doctors here. I guess you are Ali's mummy. Is not it? Yes, doctor. It is really my honor to sit with a keen mom like you, and I know you are doing a great job. Is taking care of Ali. Thank you, doctor. With pleasure, ma'am, I am here to talk to you about some of the plans we took for Ali, and hopefully at the end of the meeting we take your consent. Okay, so what is the plan? Okay, I will explain for you everything, but first, do you need anyone to be here? Okay, no. Okay, tell me how much do you know about Ali's conditions? So I know he is having hereditary spherocytosis and he is having increased the blood transfusion requirements. I wish there is a solution for that. Actually, that is why I am asked to talk with you about a procedure called splenectomy. Have you heard about it before? No. So splenectomy, it is a procedure done under the effect of sleeping medicine and done either by open surgery or keyhole surgery to remove an organ located here, pointed to the spleen site. This is called spleen. Are you with me? So splenectomy is a surgery under open or keyhole surgery. We are pointing our spleen, that is we will remove the organ because he needs much more blood transfusions to reduce that. Yes doctor, but why? So we are doing this procedure. As you know, hereditary spherocytosis is all about abnormal shape of the RBC, and the spleen is the organ that destructs and kills the abnormal cells. So by removing the spleen, we will decrease the destruction and we will decrease the blood transfusion requirements. Am I clear? So we know that hereditary spherocytosis, the pathophysiology is that they have abnormal shape of RBC, which is spleen is destruction occur. So to prevent these distractions and also reduce the blood transfusion, we are doing that. Yes, doctor. But ma'am, let me explain for you that for any procedure there are benefits and risks. First of all, there is a risk of sleeping medicine, but it is given by an expert specialized doctor in giving sleeping medicine to the children. Also, there is a risk of catching bug, but no need to worry as it is done under complete cleaning measures. And there is a risk of bleeding, but it is done by expert hands. Definitely there will be some pain, but painkiller will be given to him through the procedure and afterward. Are you with me? So what are the drawbacks of the splenectomy? They are telling, first of all, benefit versus risk. First of all, there is sleeping medicine, but expert doctor we are involving. Another risk of catching bug, but we are doing it under complete cleaning measures. And bleeding can be, but again expert doctor, they can do handle that. Some painkiller we give if pain present. Yes doctor. And also spleen has another job in our body, that it has a defensive rules against germs and bugs that enter our bodies, but we will overcome this problem by giving him some certain shots. Also it is better to avoid the infections. He will take antibiotics for life and he have to wear a bracelet. Am I clear so far? So this is important, we need to tell that. And spleen has another job in our body, that it has a defensive rule against the germs and bugs that enter our bodies, but we will overcome this problem by giving him some certain shots. So also it is better to avoid the infections. He will take antibiotics for lifelong and he have to wear a bracelet. Antibiotic taking lifelong and wear a bracelet. Am I clear so far? Yes doctor, when he will take these shots? Within 2 weeks before the surgery. So before the surgery, within 2 weeks he will take the shot. How long he will stay in the hospital? Actually the best one who can tell you is the surgeon. How long he will stay home? It is better to stay in home for 1 month and avoid contact of sports for 3 months after the procedure. So he will stay on the home 1 month and avoid the sports 3 months. Okay doctor, should I decide now? No, you can take your time. I will give trusted website and some written leaflets. If you have any further questions, we will be here to answer you and we are waiting for your response as soon as possible. So this is all about splenectomy. This is a consent scenario. Thank you.